So are there also some other specialists that, a pregnant woman should visit or should go for their checkup, for her checkup while she's pregnant?
See, if there are no complications in pregnancy, then gynecologists are the best people who can take care
Okay.
of them throughout 9 months. But if
Mm-hmm.
there are any associated conditions, like as of now we discussed about anomalies, then
Mm-hmm.
we then depending on any conditions, we have to refer them to specialists. Like for anomalies, we refer them to fetal medicine for any interventions, and if there are hormonal issues, we might refer them to doctor concerned in that. So depending on the problem, we we might take help of other specialists also. But there
All
it
right.
is.
All right.
But if the pregnancy is normal, there is no need.
Okay. So unless it is necessary, there is no need to
Yeah.
go visit any specialist. But if there
Yes.
is, some complication or anything that you're going through at that particular time, you should go see a specialist. Other than that, your gynecologist is perfectly fine.
Yeah.
So now, doctor, now, you actually mentioned in the beginning that a pregnant woman should not consume oily food, spicy food, junk food, or any food of that matter. So I actually would like to know that, a lot of women have this thing of craving, a junk or craving oily food and the spicy food. So when the craving happens at that particular time, what should they do?
See, I even mentioned if you are able to absorb spicy food, main
Acha,
problem is
okay.
digestion. Some people
Mm-hmm.
can have spicy food and they are comfortable with it. So
Okay.
there is as such no contraindication for
Okay.
oily, spicy food. Only thing,
Mm-hmm.
this is the diet which I advised was for morning sickness. Women who are
All right.
facing morning sickness, or they are not able to absorb whatever they are eating, and they are taking it out. For those women,
Mm-hmm.
we tell them to be like careful about their diet, and definitely during
Mm-hmm.
craving also we will not advise them to have this kind of food. Otherwise, some
Mm-hmm.
people have uneventful pregnancy and they can take according to their taste and however they feel.
So now, doctor, now I would like to speak with you about pregnancy during COVID. So, which is in today's time, and especially times like this when the virus is so rampant and is everywhere. Pregnancy, pregnant women are getting more stressed and more. They are getting more, I would say, tense because of it. So my very first question to you about pregnancy during COVID is: are pregnant women more susceptible to the virus?
Yeah, definitely, because their
Okay.
immunity is lowered during pregnancy. First of all. Secondly, we don't advise vaccines for pregnant women. So both make them more susceptible to virus.
Oh, okay. So I mean, one should try and avoid as much
Yeah,
they can
yeah.
going out.
Nowadays, my first advice is to be careful about corona. Then I give other advice because that is very
Okay.
important for them.
Okay. And what if one member in their family have got the virus and have got affected with the virus? What should they do at that particular time?
Yeah, we have got cases like that where husband was affected with virus, and we
Mm-hmm.
advise them not to panic. Keep hydrating yourself, isolate totally, and if you have some other member who can help you, please take help of those people. And if you can go to some other, like if some relative is nearby, they can go there and stay during the period of isolation. And yes, to check themselves also whether they are affected or not is also important.
Okay. Okay. So they should have all the equipment like the oximeter and everything
Yeah.
with them.